Welcome back, everyone. If you're thinking your face needs a little boost, the good news is you don't have to undergo the knife to get a facelift. Joining me now is nurse practitioner Lisa Williams from Ultra Smooth to tell us more. You're going to talk about the liquid facelift. What is that?
That's a non-surgical approach to lifting the face, getting rid of wrinkles, contouring it. You know, as we get older, our face starts to sag a little bit.
And this just gives it a little lift without 6 weeks of downtime from, you know, having your face peeled off and put back on.
That's right. It's only usually about 24 hours of downtime. Some people can walk out and go out that night.
Wow, that's impressive. And how does it work? You use syringes to insert a product?
Yes, I inject usually Juvederm, Restylane, or Perlane, and that primarily goes in the nasolabial folds, right in this area. I can also do the cheekbones. I can do the face to lift it up, and also the lips.
So how many syringes would somebody need to get that done?
Depends on the age and usually the damage that has been done. So somebody maybe in their 20s might need 1 syringe, but possibly in their 50s they might need 3 to 4 syringes.
All right, what are the differences between these? Because I see Perlane here and Juvederm here. What are the differences between those?
Okay, pretty much they're all the same. These are hyaluronic acid, so they're FDA approved, non-animal based, and they're manufactured by different companies, but they're primarily pretty much the same, except for that I would prefer to do Juvederm Ultra in the lips, and then maybe for really thin lines, I would like to do Perlane for deeper grooves, and then Restylane you can pretty much use for anywhere.
Now you have some before and after pictures so people can see the difference that these products make.
Yes.
We see this right here. Tell me about those before and after shots.
Okay, that's a before and after shot of I believe that's the Juvederm, so the Juvederm Ultra Plus, and that's a nice photo. That's about 2 syringes.
It looks so natural.
It does. It's really natural looking. I've never seen a problem with the fillers.
Now, right here, is this where you obviously put them in the folds by the nose?
Yes, those are the nasolabial folds. We can do the oral commissures, the Mariette lines, so you can pretty much do anywhere in the lower face.
And look at, if you notice that last shot, it had her face, she didn't look like she had a permanent frown on her face.
That's right.
She kind of lifted it up a little bit.
Yeah, it turns back the clock about 10 years sometimes, 15 years.
There we see it again. If you notice, I mean, the folds are completely gone.
That's right, and it's great.
And she didn't have to undergo the knife. That's really amazing. The products people can get now, it's just a simple injection.
That's right. I love it.
Right. And you know, if somebody's considering getting this done, what's the one thing you would tell them if they're saying, you know, I know I don't want to get surgery, but everybody's getting Juvederm. What is it about these products that really make you want to encourage people to try these first before they get any cutting done?
Well, these ones, the hyaluronic acids, err on the side of safety. They're FDA approved. So it's very rare that you see anybody have a problem with it. And nobody will know that you've had it done. That's the nice thing. It's not very expensive. There's not a lot of downtime, so there's not much risk.
Speaking of not very expensive, you said sometimes you only need like 2 syringes. How much would a syringe cost to get something done?
Well, the good news in my practice is I tend to discount the prices. And so right now we have a special. If you buy 2 syringes, you get the 3rd one free. Plus, Juvederm has a $100 rebate off 2 syringes, so it's really a good price.
Well, what are the realistic expectations people should have when they have a filler used? Because we've seen photos where they've been done. I think we have another photo here.
Right. Really, somebody needs to have realistic expectations. They cannot expect to look 30, 40 years younger after having the fillers.
That's Bridget Bardot there on the left and Bridget Bardot there on the right, years before.
Yeah, so she was very beautiful, but, you know, with time, the sun damage, the environment, constant expression use, that can do that. So if you start it young, you can probably prevent it.
All right. Well, thank you. Then put on your sunscreen. Remember, you can't turn the clock back too much, but you can turn it back quite a bit with the products you talked about. Thank you so much, Lisa. I appreciate it. Always good to visit with you. And for more information about the liquid facelifts, you can visit their website at ultrasmoothskin.com or call the number you see right there on your screen.